So anyway, so what we have to kind of think about is everything that's going on. We got to think about the underlying structures and what their functions are. There are certain things that are going to give us some information, like we talked about Curtin sign or Kersh sign of a splenic injury. You have Gray Turner sign. You have I can't think of the other one right now, and I know what it is, but I can't think of it. But have a high index of suspicion for things, because we don't know what could be going on. All right. With that said, special considerations in trauma. And also multi-systems trauma. There are things that can actually involve multiple body systems. It could be a neurological system and a cardiovascular system. It could be cardiovascular and respiratory. It just involves more body systems. Think about the mechanism required to cause all those injuries. You guys are tiring me out already. You guys have worn me out.
You want to take a break?
No.
Okay, just asking.
Just checking.
Yeah.
I'm just trying to load this up. Hey, why are you seeing yourselves over there? All right, there you go. Now I can see all your happy, smiley faces. All right, multi-systems trauma and trauma in special patient populations. So let's deal with this particular patient. Excited to hear the approach of the ice cream truck in his neighborhood. 7-year-old Carlos runs into the street to look for it. Man, Carlos can't take you anywhere. He fails to see the car approaching from the opposite direction until it is too late. Bam! Turning toward it at the last second. Don't kids do that anyway? When they're about to hit, what do kids do?
Stop.
They turned away the vehicles.
No,
They're torn
Deer in
towards
headlights.
the vehicle.
They turn to look at.
Yep, deer in the headlight look. What do adults do?
They try to move away.
They try to jump the car.
Away from it. They're like, ay chingado, esto va a doler. The bumper strikes Carlos, little Carlos, in the torso, causing his head to impact the hood before throwing him down to the ground as the driver screeches the car to a halt and yells, ¿Por qué te pasó, chamaco? Por pendejo.
Yep, that's what my mom said.
So, how will his age affect the type and distribution of his injuries?
His torso, so They're more compacted together, so it's a greater injury.
Okay. Where are their injuries going to be located?
Abdomen.
Abdomen and chest.
Okay, so higher up. More or higher risk for internal bleeding in injured organs. And we talked about this a moment ago. How might his injuries present differently from the same injuries in an adult patient?
Well, location as well.
Okay.
Well, if he might be going into shock, it's gonna be a little bit more difficult for him to maintain body heat or body temperature.
What else?
He's gonna have more soft tissue injuries just because he's smaller, or like his size.
But also, there's not a lot of protection. They have less mass, so that energy doesn't get dissipated very well. What differences are required in the assessment and management of this patient as compared to an adult? Well, one, the way you talk to them, and might that little kid be crying?
Yeah.
And we're talking about little Carlos here, so little Chillon.
Yes.
Whereas big Carlos, well, maybe still Chillon, but not as much. So one of the things about multi-system trauma is it's a lot, little Chillon right there. Different hairdo. It makes it more challenging because there are multiple body systems involved. You have to worry about respiratory issues. You have to worry about bleeding issues. You might have to worry about fractured bones. You might have to worry about the abdominal injuries. So it's a lot more. And the other thing too is, again, it goes back to having to be a psychic about it. Okay, what's going on here? What else could be going on here? I remember going on a call. It was a auto versus an ATV, and it was a husband and a wife on the ATV, and this guy was driving the pickup, and somehow they crashed. The wife was saying that the pickup truck was doing about 70, so that's a pretty good speed, and they crashed head on into that pickup truck. They T-boned the pickup truck. Well, her head went flying into the window of the pickup, the passenger side window. And she suffered an elbow injury as well. So is that multi-systems trauma?
Yes.
Okay.
Yes.
So we have a musculoskeletal system injury, maybe a soft tissue injury, I don't remember that. And then we have a head injury. And so based on what we've learned about head injuries, tell me, what do you need to keep in the back of your mind?
A spinal injury?
Okay, spinal injury, what else?
Shit.
I heard that. Respiratory? What about respiratory?
Yeah. Well, I guess that kind of goes with spinal injury. If that's cut off, then it could affect the respiratory.
Okay. What else?
Skull injuries, brain injuries.
Don't take
Bleeding.
hog glory for yourself. Bleeding where? I was talking to Carlos.
Internal bleeding.
Where?
Mm, in the body, like
The brain.
All right. We got to think about a brain bleed. We got to think about a brain injury. So, what do you want to keep an eye on?
Maybe their mental status.
All right, their mental status. And how would you do that?
Keep talking to them. Have a
Ask them
conversations
a
with.
question. See if they can.
What was that?
Maybe ask them a question and then see if they can remember it. Like check in
Okay.
5 minutes or so.
Okay.
Could it also be check their pupils?
Okay, check pupils. So let's talk about that real quick before we get back to the other stuff. What are we looking for with the pupils?
If they're unequal.
Dilation.
Yeah.
Unequal, okay?
Mhm.
If they're unequal, what might that indicate?
A concussion?
Okay, what else?
A bleed.
Brain
Bleed, what else?
A brain injury.
What else?
don't you also have to check if they dilate?
Well, we want to see the responsiveness to the light. So is it sluggish? Is it normal? What I'm getting at is it could also indicate increased pressure on one side of the brain. All right. So back to the question, literally what Kayla had said. We want to check their mentation. Well, remember we mentioned about giving them something simple to memorize? And when
Yeah.
you reassess them, ask them, so what was that phrase or what was that word that I told you to remember? And I've told you guys about asking them about how I tell them, I give them my name, and then I ask them, okay, so what's my name? And you could use whatever it is that you want to do, but it's something simple. What else? So reassess them. What else are we looking for as far as questions?
Probably their history.
Okay, so we want history, allergies, and medications. But now let's look at specifically about questions.
Are we still talking about
Yeah,
a
they're
pediatric patient?
No, we're
Like
way
in general?
past the pediatric patient. I'm talking about a head injury patient.
Would it be like the A&O times 3?
Well, okay, their mentation level. So are they confused? But what I was talking about with questions is repetitive questioning. Remember, they start asking the same thing over and over, like what happened, where am I at, what happened.
Oh, okay.
Mm. All right. So to finish off that patient, so I'm transporting her. I'm in the back with her. It's actually a dual paramedic unit, but I'm in the back with her, and I had told her my name, Luis Miguel, and I kept asking her that question, and she was doing pretty good, and just making sure, keeping an eye on her. And then all of a sudden, she starts getting a little slow in answering that question. And then she started asking me the same stuff over and over. What happened? And I would tell her. And so I eventually told my partner, hey, you know what? She's starting with the repetitive questioning. She's forgetting simple things. Let's bump it up. So we went code 3. We were going to take her to Sierra East, but because of the repetitive questioning and everything, we made her level 2 trauma and took her down Del Sol. She was very lucky. She got discharged a few hours later, and somebody had mentioned the concussion, and that's what she was diagnosed with, which she's very, very lucky, I think, based on the impact. So multi-systems trauma, and that's something not that bad. Now, there are other worse ones where the patient is so foobarred that they die right there. There's nothing to do, or maybe they don't have a very good outcome. So usually with multi-systems trauma, there's a lot of force being applied on the body. That all gets transferred to the different body parts. Now, these patients, they tend to not do very well. Either they have a high incidence of dying, or they have a high incidence of severe injuries that last a long time. And that's what the morbidity is, a long recovery time from the significant injuries. As well, there is a higher incidence of shock because of all the bleeding of everything that's going on. Injuries to the heart, injuries to the kidneys, injuries to intestines or the spleen, the liver, the lungs, different body parts. So really, the care for multi-systems trauma is really going to depend on which systems are involved. Might have respiratory issues to worry about. You might have cardiac issue maybe to worry about or take care of. As a musculoskeletal and soft tissue. Well, that's kind of one system, but so what do you have to take care of? I'm trying to think of another one. Multi-systems trauma. Remember I told you about the kid? The one where I said, oh shit, that he looked like an Egyptian figure? That happened years ago. Remember that when we did patient assessment, I gave you 2 examples of oh shit. One was the dude that avulsed a piece of his scrotum, and the other one was that kid that had fallen off the freeway overpass, that he looked like an Egyptian figure. There was chunks or pieces of bone down the freeway. Does
Yes.
remember that?
that one. I don't.
Claudia does.
Yeah.
So anyway, that would be a multi-systems trauma. Neurological or nervous system, you got the musculoskeletal system. Those are the biggies. So really, the best thing to do for them is get them to the hospital, to the trauma center, so the surgeons can do their magic, or at least practice their craft. And that's what the trauma surgeons are all about. That's why level 2, level 1s, they have to go to a specialized area because they have those trauma surgeons there, and they could give the patient the best chance of surviving this event, this insult. So what we have to look at when it comes to trauma, multi-system trauma, we got to think about the forces, the kinematics, what cause the injuries. What can we do to get the patient to their destination quicker? It's really about managing the ABCs. Ensuring you have a patent airway, that you're ventilating the patient, either BVM or non-rebreather, controlling major bleeding. They look for major bleeding, including internal bleeding. Be on the lookout for internal bleeding. Yes, Mr. Calderon.
So almost all multi-system trauma is rapid transport. There's no exception.
Not necessarily. And I'm trying to think of an example where you could have multiple systems and not necessarily be a load and go type of thing. I think the best answer I can give you is you got to look at the mechanism.
Thank you.
No problem. Are you taking it? Okay. All right. We talked about controlling the ABCs. Do a thorough secondary. Look for injuries. Look for anything else that might be going on. Try to get a medical history from them. Seeing what other medical problems that they might have. That might make them even worse. Do they have a bleeding disorder? Do they take anticoagulants? Do they have heart problems? Do they have breathing problems? You want to immobilize them right away. Right away. Don't worry about the minor injuries. If you have some significant things, take care of that first. You could do all this other minor stuff in the back of the truck. Take care of the major stuff first. Things like traction splint, things like you need to immobilize them as best as you can. If they have a fractured forearm, who cares? If they have a fractured lower leg, who cares? If they have fractured femur, take care of it. If they have any neurovascular compromise, take care of it. Significant enough MOI, let them go. But think about your mechanism. Let me see. Let me look for something real quick. Years ago, I had a pretty good PowerPoint on trauma, but I lost that thumb drive and pissed me off because I didn't save it to my hard drive. Where'd you go? Venue. You guys are too quiet. Mhm. Mm. Thought I'd found a good PowerPoint, but no. See this one, how this one is. Mm. So, I wish 1, 2, 4. Can you guys hear me?
Yes.
Yes.
Because you guys were awfully quiet. Oh, I remember this. Fix it. Oh well. So I was trying to wake up, Ina. So I was trying to find some good pictures to show you multi-systems trauma. And like I said, I had great PowerPoints for multi-systems trauma, but I lost that thumb drive. I think somebody stole it from me. Anyway, so a question was given to me. So let me give you this example. The question was, in a car accident, ooh, and you could see the brain. As long as brain tissue is not exposed, like chunks of brain coming out, they might still be alive. And if it's just that head injury, it's just that head injury. But if there's other things involved as well, then that would be a multi-systems trauma. As long as they're conscious, it's an open head injury. So let's get them out right away. Do you remember, did I tell you the story about the young lady that the week after Thanksgiving, she was involved in a car accident? She got T-boned by a heavy-duty pickup truck?
No.
I don't think so.
No? Okay. So, like I said, it was the week after Thanksgiving. She's driving to work. It's early in the morning, about 9 o'clock in the morning. And it had been drizzling, and it hadn't rained in a while. Unfortunately, her tires weren't the best, and she was going a little too fast, and she kind of lost control of her car. And she started skidding and ends up getting T-boned by a big, literally utility vehicle. It was like a F650, 750, something like that. And it bashed in the passenger side, and it brought down the ceiling, the roof of the car. And so, upon impact, remember with T-bone, your head kind of moves as a result. Well, that's what happened with the ceiling, and it was on her right side. The ceiling was brought down. Her head went and smacked it, and it exposed her brain, and even had some brain tissue in the hair. By the time we got there, and we didn't have that long of a response time, usually around 7 minutes. When we got there, she had just expired. And what I'll never forget about her was she was her head was laying on the passenger seat with blood coming out, and she just looked nice and peaceful with her eyes closed. But it really sucked because because Thanksgiving had just passed. And so again, a little bit of multi-systems trauma, because not only the head injury, but also, she could have had other types of injuries to her chest as well. But what did her in was that exposure of the brain and bringing out brain tissue as a result as well. So any type of brain matter in the hair or coming out, it's usually fatal. All right. So.
Was that here?
No. So Jonathan is pregnant. Hey, it could happen. And so the concern is, number one, the fetus, but two, the mother. Because actually we haven't really covered this, but I thought I did cover this with you guys. How much does the blood volume of a pregnant woman go up by?
None?
No, it does go up.
What did you ask?
Double?
Is it 40%?
50%? No. Oh, yeah, it can up to 50%. Yeah, it's about 40 to 50%. And so in order for her to be in shock, how much volume does she have to lose before she does present in shock? 40%. Because they increase their blood volume by 40%, they need to lose that 40% before the person starts showing signs and symptoms of shock. Okay. And the uterus is very vascular as well. So any injury to the uterus will cause the mother-to-be to
Bleed out.
lose a lot more blood. Yeah. All right. So you got to remember with the fetus in there, the uterus is going to go up a little bit more. And what we want to try to do is we're going to fight a little bit more aggressively for the pregnant mother-to-be. Number one, we want to try and keep that fetus viable. If the mother-to-be goes into cardiac arrest, we're going to do CPR, get her to the hospital so they can do an emergency C-section and get that little squinkle out.
Lou, going back to the blood volume, when you say blood volume, like literally there's 40% more blood in her? Or
Uh-huh.
okay. So does that affect in any way her blood pressure? Because I mean,
Yeah,
if you have
yes.
more blood, so are you saying like pregnant women either have higher blood pressure or
No, it adjusts, but we don't want them to have high blood pressure. If they do, they develop what we call PIH. And this is all pregnancy stuff we'll talk about next week.
okay.
PIH, pregnancy-induced hypertension, which is not a good thing. So it can go up, but preferably no. All right. What else? Diaphragm's further up. Pain perception in the abdomen is decreased. Higher risk for not just bladder injury or not just uterine injuries, but also bladder injuries. And so again, we were talking about internal bleeding earlier. Credit on it, Sterling. I guess I te la pegué. Not only do we have to think about those injuries, but we got to think about the underlying things and also bleeding, internal bleeding. We might not see that bleeding right away. And again, remember, the blood volume is going to change or has changed, so they have to lose more before we could see the signs and symptoms of shock. And so you really got to take that into account. Now, the good thing, I'd say about 99% of the mothers-to-be, if they're involved in like a car accident or have suffered any type of trauma, actually, I'm going to go lower than 99%. I'll say 95%. They want to go to the hospital. They don't want to risk anything bad happening. The reason I say 95%, because there's a percentage that just don't care, or because the boyfriend or husband or their significant other, and I've heard these stories from actual patients, where their significant other kicked them in the gut to try to cause a pregnancy to be terminated. Now, talk about being fucked up, and that guy should be shot. But so it does happen, and I think that a lot has to do with either embarrassment or they don't want something bad happening to that person. Like, no, dump the asshole. As we're going to learn when we do OB, you have your exam on Monday, so I think OB is on Wednesday. So, oh, I can't wait for you guys to see the childbirth video. As I mentioned about taking care of the mother-to-be, the more significant the injury is to the mother, the greater likelihood there is to the fetus because the fetus gets its food and nutrients from the mother to be. The kid's not eating on its own. That's why women gain weight, because they're eating for two. So. Let's see. We'll talk about abruption placenta next week. Now, one of the things that can happen due to abdominal trauma, Carlos, is premature contractions. So depending on how far along they go when we get them to the hospital, they might stop labor because it's not time yet. Kid's not fully developed. It might actually be worse. So. About that. Did we talk about supine hypotensive syndrome?
I don't think so.
Okay. What happens? Actually, didn't I ask you guys what side, or some of you ladies, what side you slept on when you were pregnant?
Yes.
Yeah.
Oh yeah.
Okay. I remember we mentioned that inferior vena cava is getting compressed by the fetus. So if we have the mother supine, she might develop that supine hypotensive syndrome. So we need to tilt her and the backboard at an angle, about 45-degree angle. Or 30 to 45, just something to get that baby off that fetus. Off that inferior vena cava. All right. Nothing different. We talked about the vagina. I will talk more about it next week. Talked about shock. Major traumas, like I said, think about the transport that you might need. You may need a helicopter if you're really far away. Although Horizon or Mercy Air pulled their, no, not Mercy Air, Native Air pulled their helicopter from the Horizon campus. So you're SOL. All right. See, that's your fault. Ugh. All right. Take a note. Take note. We're going to talk about this again when we do pediatrics. And if you thought the burn quiz was horrible, wait till you do the pediatric one. Yeah, be forewarned. The number one cause of death amongst kids is trauma. The number one cause of death amongst kids is trauma.
May I ask why?
I will tell you in just a second. The number one cause of death amongst kids is trauma. The reason being is their little bodies can't handle a lot of mechanism, a lot of energy. And little kids are curious about stuff. They don't understand it. Why do you think we have to teach them? No te metas ahí. No agarres eso. No agarres aquello. And as you parents know, what do you think when you don't hear your kids?
That they're doing something that they're not supposed to.
Exactly. They're getting themselves in trouble. And they're curious. How many pediatric drownings do you think happen every single year, despite all the warnings? Parents don't, remember, they're curious. So parents don't put the covers in the sockets. They don't secure the cabinets. They leave chemicals out or readily accessible. I remember a kid, I don't remember if it was an earthquake or he yanked down the dresser, but he had a big, this kid, he was like 4 or 5 years old, had a big screen TV fall on top of him and killed him. So trauma is the leading cause or the number one cause of death amongst kids. So did that answer your question, Joanna?
Yes, sir. Thank you.
Okay. The other thing too is abuse. Abuse does a lot of trauma to little kids. Beating the crap out of them. Burns are very common for child abuse. The other thing too is shaken baby syndrome, and that one pisses me off too, especially I was talking about this with the morning class, and they were telling me about a case a few years ago here in Las Cruces or both, and I know it happened in Escondido when I was out there, where this guy shook a baby, killed a kid, and the guy was the boyfriend, the mother's boyfriend. And then they help cover it up. It's like, what the fuck? Sorry. But I feel that way. What's happening with shaken baby syndrome?
Damaging the brain.
Damaging the brain. How?
Isn't it like whiplash?
Not necessarily whiplash, because whiplash is a hyperextension of the neck, but it's something else.
Well, the brain is hitting the skull.
And what do we call that?
La mollera. I don't know how you say it.
Oh. Do you remember that term?
The soft fontanelle?
No, but the fontanelle is going to be, whenever there's brain injury to an infant, the brain can bulge out through the fontanelle, or you'll see it bulging out. Yeah. What do we call that type of injury with the brain striking the skull?
Oh shit.
Can you repeat it, sir?
What is the name of that injury where the brain hits the skull?
Contra brain injury?
Yeah, what was that again?
Contra coop? Contra coop?
There's more to it than that. You're partially right.
It's coup contra coup.
Traumatic brain injury?
No, I mean, it is a traumatic brain injury, but the type of injury we're talking about, between you and Claudia, you guys got it right. It's the coup contra coup.
Coup contra coup.
Yeah, remember I told you guys that boing, the brain shifting forward and hitting the skull, the brain going back, hitting the back of the skull, and it causes what?
Brain injury.
A brain injury, but more specifically?
Swelling?
Okay, what else?
Is it the brain hitting the skull?
Yeah, the brain's hitting the skull. So what kind of injury are you also going to have?
Question?
Hemorrhage?
Question?
What kind of hemorrhaging?
Internal?
Yeah, but what kind of a hemorrhaging? Huh?
Or subarachnoid?
Not necessarily.
Like cerebral hemorrhage, or do you mean pertaining to like the layers?
Nope, not the layers. It's not necessarily cerebral hemorrhaging. It is, but how about a cerebral contusion? All right, give me a quick sec. Yeah, so cerebral contusion, brain. So that's why I was saying, yeah, it's internal bleeding, but more specific, it's bruising. All right.
Up to what age does shaking baby syndrome happens?
I mean, as far as the coup contra coup, that really can happen at any age. Too much headbanging can cause cerebral contusion. Excuse me. To be able to really grab them and shake them, they have to be small enough to be able to hold, lift up, and shake. I still think they should be shot, whoever does it. Forget the trial. Just get straight to the punishment. Dude, come on. All right. So there. So to finish answering the question, it most often occurs in children younger than 2 years of age, but can be seen in children up to 5 years of age.
Okay.
Yeah, at that age, they're still fairly young. Ooh, Maryland. The shock trauma is an excellent facility. All right. So, like I said, they're very, very frequently victims of trauma. And that's because they're very curious, they're small, they get into all sorts of stuff, they don't know any better, they're left unattended. Someone I know just left their kids unattended while they went traveling the country. The oldest is 13, the youngest is like 8. And then 2 of them were fighting with each other, 2 of the kids, and they were even throwing knives at each other.
Oh God.
Yeah, it's like, what the hell? So, I'm not gonna worry too much about the pediatric assessment triangle right now. We'll cover that in pediatrics. But remember with kids, actually we haven't really covered kids in the past. With kids, they're very resilient. And actually, I think we have talked about this. Kids are very resilient. They're going to tolerate a lot. They can compensate very, very well. It's once they deteriorate, once they deteriorate, that's when it gets scary, because they will do it very, very quickly. And so we have to have a high index of suspicion when it comes to kids and any type of trauma. Because again, they will compensate very well. They maintain their blood pressure very well, their pulse rate. It's when they start to deteriorate. It will be very, very quick. And you want to talk about soiling your shorts? This is the time. So, I'm trying to remember if I mentioned this to you guys before. Even though here it says kids, or let me rephrase that. For little kids to try to get a blood pressure is very, very difficult. Now, it's not impossible. It's better with a machine, but try to get manual blood pressure on a kid, that's gonna be difficult. Most books say they have to be at least 3 for you to do a blood pressure, which is true. But in reality, we wait till they're about 7. So before 7, the way that we assess perfusion is through a capillary refill. After 7, then that's when we get a blood pressure. Okay. Mm. Remember in airway and in general, their head is bigger, right? In proportion to an adult. It's a lot bigger. So as a result of that, what happens to the airway when we lay them flat?
It constricts.
No, it doesn't constrict.
Doesn't the
Be a
tongue like the tongue blocks the airway?
Okay, that could happen with an adult as well, but the tongue is bigger in proportion as well inside their mouth and with an adult. So yeah, the tongue is going to play a significant role. But what else though?
The trachea?
It's smaller. What else?
I think it's more like just because it's in like in an awkward position, like since it has a bigger egg, you're just like making it into like an awkward.
Correct. So now Maricela got the yawning bug. See, I know what you started. An infant trachea is funnel shaped, whereas an adult is a tube shape. Tube, there you go. No, I'm doing Chespirito. The dudes. No, because of the bigger head, remember, it goes back and then the shoulders are lifted, and so it closes off the airway. So what must we do to ensure an open airway with a small child?
Don't we put something in the
padding.
shoulders? Yeah, like padding.
Okay, more specific, be more specific.
Don't you put like a towel, rolled towel in their neck, in the back of their neck?
No, under the shoulders.
Oh.
Remember, it's a folded sheet or towel underneath the shoulders to bring the airway into alignment. And so we put them on that backboard. Again, that airway is going to be actually like this. You guys might not be able to see me very well. So putting that folded sheet or towel underneath the shoulders will help bring the shoulders up and keep it and keep that airway open. So make sure you pad that backboard. Be very aware of any airway obstruction. Okay, let me check on something. All right. I want you guys to remember one thing, and that is that kids depend and lean on their respiratory drive. It's not so much the it's not so much their cardiovascular. Like us adults, we're gonna do more with we're not gonna do. So where was I? So much about the cardiovascular system because they lean on their respiratory drive. And understand this: the number one cause of cardiac arrest amongst kids is respiratory issues. Okay. The number one cause of cardiac arrest is respiratory issues.
I'm sorry, can you repeat that again?
Yes, ma'am. The number one cause of cardiac arrest amongst kids is respiratory issues.
When you say kids, to what age do you give them?
Pediatric patients. So really up to about
Do you mean like asthma and stuff like that?
it can be, yeah, if they have a severe respiratory or severe asthma attack. Yeah, I can go in cardiac arrest. I'd say below 8 years of age.
Thank you.
You're welcome. I'll pause here. It's 8:05. So take a 15-minute break, be back at 8:20. Okay.
Okay.
All right, I'll see you in a few. Ya apagué la cámara.